Hello, everyone, and welcome back to the Office of Community Outreach and Engagement's video series. Today, we'll be having a short conversation about cancer health equity and community health workers. And in fact, this video will be the first in a series of videos related to cancer health equity. So be sure to look out for those. To help us get familiar with community health workers and cancer health equity, I have a very special guest with me. I have Ms. Ifrah Mohammad. Ifrah, thanks so much for being here today.
Thank you for having me, Dylan.
Ifrah is a community health worker herself with over 7 years of experience providing direct support to immigrant and refugee communities. She is originally from Somalia and came to this country as a child refugee. In her free time, she likes to write and watch cooking shows. So what more could you want? Am I right, Ifrah?
Absolutely.
Yeah. All right. Well, with that said, let's jump right in, shall we? What is the Washington State Community Health Workers Association?
Well, that's a really good start. WACHWA is a nonprofit that advocates and supports the community health worker workforce by continuously improving trainings, professional development, access to resources, and job opportunities across Washington State. As you know, community health workers are an important part of the healthcare system in both rural and urban areas because they're helping to reduce health disparities and increase the use of health services. CHWs share similar lived experiences with the community members that they serve. And it is this unique opportunity really that brings information to where it's needed the most, that allows CHWs to provide a personalized and culturally appropriate care to underserved communities.
As a representative from the Washington State Community Health Workers Association, can you talk a little bit about what do CHWs do to support patients with cancer?
Oh, absolutely. CHWs help those who have been diagnosed or are waiting results in a number of ways. They help patients navigate systems, connect the patients to support groups, which are really important, either transport or help find transportation to appointments, even provide an ear to talk to, which is very helpful in times of uncertainty. And they go to appointments as needed and check in on them outside of the clinic when they're at home. And the list goes on. CHW serve as liaisons between communities and services available. They also support initiatives that provide basic cancer education, which cover what cancer is, what cancer does to the body, and treatments that are available. This particular initiative that I'm talking about has led to increased screenings, especially for colon cancer. And a big part of that was due to CHWs that were able to deliver the information in multiple languages. And we talked about this previously, but at the community level, there's some anxiety about getting screenings because cancer is largely or still seen as a death sentence. And a part of minimizing or a way of minimizing that fear is to share critical information that screenings can lead to early detection, which can save lives.
What are some facilitators and challenges you see facing CHWs of Washington State right now?
And that's a really good question. The approach that I just talked about is one meaningful example that it's working. Many professional ads or articles are in English, and so that knowledge is not being transferred to communities that speak other languages. With greater support and investment by healthcare systems, CHWs can close that gap and increase the use of health services because they are in these communities and they speak the languages of the community members that need to hear this information. Right now, a lot of CHWs are also involved in COVID care coordination, and they are essential workers, frontline workers as well. And we're advocating for equitable pay. With low pay comes high turnover, and this makes it challenging to support community members with chronic health issues. We must work better in Washington State and honestly across our nation, across the country, to compensate CHWs and patient navigators in order to make this profession more sustainable so CHWs can provide greater or more stable support. Another challenge is telehealth, and it's because it's not easy to have a human connection while socially distancing. In Eastern Washington, for example, there are resources available in major cities, but not so many in rural areas. And a large part of this is because telehealth has limitations particularly in rural areas because it's part of a larger telecommunications issue. This means that CHWs are limiting their home visits and are being challenged to connect clients to resources in a timely manner. Urban telehealth challenge is mainly around people who are unfamiliar with the technology being used. So it just requires a training period, but it doesn't necessarily cause a delay in the services needed.
What are you most proud of when it comes to WACHWA?
Honestly, our members. I'm most proud of our members. They are the reason why we're here, and more importantly, they are a compassionate group of people who center and prioritize folks in need. They are CHWs and they are essential workers, especially during COVID. They're doing a lot of COVID care coordinations, and they have a reach to community members. They can reach community members where they live, where they eat, where they pray, where they call home, because they are part of the communities that they serve, and they play a critical role in keeping our communities healthy. And they are the driving mission here at WACHWA. We want to take care of those that are taking care of others.
Ifrah, thank you so much for sharing knowledge with us about your organization today. That wraps up our questions. However, for our viewer audience at home, if you are interested in more information about the Washington State Community Health Workers Association, please visit the resources we have linked to this video, which includes the organization's website. Ifrah, any last words?
Absolutely. If you're interested in WACHWA or just and would like to become a member, or you want to be part of any of our 4 vibrant committees, even if you're just curious and would like to know what WACHWA is all about and want to attend a monthly meeting, please email me and I will get you set up. My contact information, as Dylan mentioned, and the WACHWA website will be shared at the end of the video. I want to hear from you, so please reach out.
Thank you so much for your time today. Thank you, Ifrah, and thank you to our viewer audience. For everyone at home, please remember, stay safe and stay healthy.
Absolutely.